Okay, perfect. Never mind. Okay, so I'll start now the presentation. Everyone can see my full screen, right?
Yes.
Okay, perfect. So, hello everyone, my name is Pedro Barata. I'm the current EMSA Vice President of External Affairs, and this is a small question and answers for the call for CPME intern. So, before we start, I think it's just important to first introduce a bit of what is EMSA. EMSA is the European Medical Science Organization. We were founded in 1990 in Brussels, in Belgium, and our main vision is just a united and solidary Europe in which medical science actively promote health. And then our mission to contribute to our mission to our vision is just to empower medical students to advocate for health in all policies, excellence in medical research, interprofessional healthcare education, and the protection of human rights across Europe.
I
We are
think your
struck.
screen is not sharing. I think we're just stuck on the first
Oh,
slide.
no, wait. Like this is sharing, right?
Yeah, we can see now we see the second slide.
Okay, and I'll just present like this.
Yeah, perfect.
Wait a second. So a bit of our structure, we are divided in EMSA executive boards and then officials board and supporting officials. We have various departments, so internal affairs, external affairs, capacity, and finances. In part of our work, we work a lot with European medical organizations, which are just organizations made of doctors at an European level. The most important ones is Standing Committee of European Doctors, which is EMSA, is an association organization, and that's where this internship is done. CPME represents National Medical Associations, so just associations that represent doctors of a certain country across Europe. And since CPME contributes to the medical profession's point of view to EU institutions and European policymakers via proactive cooperation on a wide range of health and healthcare related issues. They also promote the highest level of medical training and practice, and they promote the provision of evidence-based, ethical, and just equitable healthcare services. They are divided in certain sectors, and the people inside it just do different sectors as well. This is the board of directors, so they are all doctors. They are from 2025 to 2027. And this is the secretariat. This is the people that that you will work more closely with. So these are the people that are staying in Brussels and are in Brussels every day and work there. And Mr. Sarada Das is the secretary general and is the person in charge of the internships. So now a bit of information about the CPME internship in itself. So it's at most a 6 months paid internship from 1,000 to 1,050 euros. It depends a bit on the day, on the month and number of days. It's in Brussels and no accommodation is provided. Nevertheless, we in EMSA and CPME as well can give any type of logistical support in finding accommodation if needed. As part of EMSA supporting officials, because the CPME intern is an addition to the Department of External Affairs, you have 1 day a week of work for EMSA. You have monthly EMSA European Board meetings, monthly the Department of External Affairs meetings, and attend events in Brussels on behalf of EMSA. So how it works is you have, as part of the CPME secretariat, 4 days a week, which you work from 9 to 5:30 in support to the secretariat in just daily coordination. You also attend some external meetings on behalf of CPME, normally in the work time, and prepare written reports for CPME members. And you also contribute to CPME's policy work, including research, drafting, and monitoring. Lastly, you also assist in the organization of CPME events and meetings. So there is this division. As you are doing an internship in Brussels as an EMSA representative, you do some work for the organization, and as you are also part of the Department of External Affairs. But on the other days of the week, you are working for CPME. You can find more information just on these two documents that we have, just the CPME intern position description that has everything that you need to know, both about the work that you do for EMSA and the work that you do for CPME. And we also organize just some commonly asked questions and some answers as well in this document. You can find them all in the link tree in our Instagram. Some requirements that are also important to mention. You need to be a medical student or have graduated between 2 years. So, for example, it's not from if you have graduated in 2025, you in December 2025, you can apply if you're still a doctor until December 2027. So it's 2 years, counting from the month in which you graduated. You need to be an EMSA member. So if you're a students association or faculty member organization is not part of EMSA, you can also apply for individual membership and then apply for CPME internship. For CPME intern, we give preference to an someone from an EU member state, mostly because of the work visa, but this is not necessary. Also, some requirements that we have is just to have someone that's strong and has a professional attitude, a lot of motivation and willingness to learn, the ability to work efficiently in a team and in a multicultural environment, and also, and naturally, having the availability to relocate to Brussels for the 6 months internship. Additionally, having a strong and written and spoken English skills, as all the work that you do will be in English. Knowledge in French is not necessarily necessary for the position, but sometimes it helps out, but it's not necessary. So the work that you do in CPME, it's a lot based on, as mentioned, just in advocacy and going to events and helping out the secretariat. But it's also very important to mention that this work, you are followed from the beginning to the end. Okay, you have the beginning of the internship, you have 1 or 2 months where you are getting a lot of support to really understand what you need to do. And afterwards, it builds up so that you get more and more independence. You also have to understand that says this is an internship and it's not just a full working position. They don't expect you to know everything about everything. You don't need to be the best doctor or the best advocate ever, because this is a position in which is expected for you to learn. Now, I would just like to give the floor to Simon to just talk a bit about his experience.
Thank you. Yeah, so I relocated to Brussels in March, and I think this experience has been actually, I've learned so much. I was not a ready advocate before this, but was really interested, of course, in health policy. And I would say that the EU is a bit of a complex machine. It's not always so easy to understand how it works from the outside, but going in to this, it was a bit hard in the beginning to understand, but oh my God, I have learned so much, and it's very. I feel like this office, the CPME office, the staff there, they're really taking care of me, and they're inviting me to attend meetings. You can go to the Commission, you can go to the EU Parliament. You also do that on behalf of EMSA. And today I had a meeting with the Latvian health attaché. So you really get to go out there and see how the EU works from the inside, and to see how this very professional organization, CPME, how they work, how they develop policy, how they advocate, and how they communicate, and all these things. And I would say that after this, I feel more empowered, maybe to be an advocate at home. Maybe now when I see things that I don't think are right, I would say that I have more tools to kind of address the issues. And yeah, and it has been really interesting and fun.
Okay.
Maybe I'll stop there.
Thank you very much for sharing your experiences. I wanted to ask if anyone has any questions. We received some questions via the forums and for people that couldn't attend. But if anyone wants to go first, please feel free to. Okay. So one that we got was if you believe that this type of internship just helps you pursue a career in Europe or in health policy overall.
Yeah, definitely. I think it can be quite competitive to get roles in the EU and so on. So really having an experience really gives you a foot in the door. Either if you want to apply for your local government or at the commission or anything there or the parliament, they have also internship positions or entry level positions. It's really crucial to have something that makes you stand out on your
Mhm.
resume. And this is definitely.
Okay. Something that we also ask is what is the inclusion of this position inside EMSA? So maybe I can answer this one. So I briefly explained, but the Department of External Affairs has official supporting board, and Simon is part of the official supporting board. This means that he has to go to the EMSA European Board meetings, Department of External meetings, and is also invited to attend our GAs. For the financial costs for the GAs, they get half of the fee covered, and for travel support, depending on where the meeting is held, it goes normally from 50 to 100%, depending on the costs from the overall from the rest of the team as well. Okay, a question that we had, is it needed to have health policy experience? Maybe you can go ahead, Simon.
Yeah, so no, I don't think formally that it's needed at all. No, it's about learning, and but of course, the more experience you have, it will be good for you when you apply. But it's not required, and I did not have any specific experience before this position.
Hmm. Just to add up to what Simon said, experience is not necessary. When the person is selected, they have an onboarding. So although the position starts in September, as soon as the person is selected, they will have 2 or 3 months to just get an handover to get used to what EMSA is doing and preparing just the person for the position in itself. And even then, when they are in Brussels and they have to do any work on behalf of EMSA, they have the support from the VP and the rest of the team. And when it's on regards to CPME, they have full support from the secretariat as well. Okay. A question that we also have is how do you think this increases your capabilities as a doctor?
In many ways, you learn how to read and comprehend evidence. This is a big thing for us as doctors. Just you know, you spend so much time trying to understand evidence and so on, and this gives you more insights into that aspect, but also like all these public health priorities that are discussed at the high level, they really affect how we work, and you get a lot of evidence given to you on what's going on. And as a doctor, I think it's really important to also be a good advocate. So learning on how to do advocacy, I think it's crucial, because if doctors don't raise their voices, other people will. So I think, and this is on local governance level, and on EU level, and so it's
Mhm.
important everywhere.
Yes, okay, that's all the questions we have from the forums. I don't know if anyone has any other question. Okay, so I'll now stop recording.